All right. Good afternoon to all of you, and we're happy to be starting almost on time today. As you saw yesterday, the Secretary General launched a report on the socio-economic impact of COVID-19. That report was commissioned by the Secretary General and prepared by the UN system as a whole. The report notes that the world is facing an unprecedented test, and this is the moment of truth. With societies in turmoil and economies in a nosedive, the Secretary General stressed that we must respond decisively, innovately, and together to support the spread of the virus and address the socioeconomic devastation that is being caused in all regions. And today, in a new report from the Department of Economic and Social Affairs, which is its regular World Economic Prospects report, the department warns that the global economy could shrink by almost 1% this year. That's 0.9% due to the COVID-19 pandemic. The report notes that countries locked down in Europe and North America have hit the service, hospitality, and transportation sectors very hard, and collectively, they account for more than a quarter of all jobs in those economies. The report goes on to warn that the effects of the restrictions will soon spill over to development countries and could lead to a significant contraction of global manufacturing, disrupting of global supply chain. Furthermore, the report says that as the pandemic worsens, economic anxiety and inequality will increase even in high-income countries. You can read the full report online. An update on the humanitarian response plan. Our humanitarian colleagues tell us that as of yesterday, they have provided a combined $78.8 million to COVID-19 responses. This includes $75 million from the Central Emergency Response Fund, with the rest coming from country-based pooled funds. So far in 15 countries, the UN So far, programs in 15 countries have been supported through these funds, and an additional countries are being identified under the global SURF allocation of $60 million, one of the largest ever made to kickstart the COVID-19 global humanitarian response plan. The allocations prioritize the most vulnerable people, including the elderly and people with disabilities, and will save lives by scaling up the readiness and response, limiting the further spread of the virus and mitigating the impacts of the pandemic. We also have an update on pledges made following last week's launch of the response plan. As of today, close to $374 million in generous donor funds have been made available. Funding the plan will save lives and equip humanitarian agencies and NGOs to treat the sick while protecting healthcare workers, and also help secure logistics backbone for continued delivery of aid and to people caught up in the world's humanitarian crises. Looking around the UN system at what other agencies and parts of the system are doing, the International Atomic Energy Agency today said it is sending a first batch of equipment to more than 40 countries to help them use nuclear-derived technology to rapidly detect COVID-19. Dozens of labs in Africa, Asia, Europe, Latin America, and the Caribbean will receive diagnostic machines and other machines to speed up national testing, which is crucial in containing the outbreak. They will also receive biosafety supplies such as personnel protection equipment, lab cabinets for the safe analysis of collected samples. Further deliveries of equipment to the growing number of countries seeking assistance are expected in the coming weeks. More on the IAEA's website. And the World Meteorological Organization today said it's concerned about the impact of the pandemic on the quantity and quality of weather observations and forecasts, as well as atmospherics and climate monitoring. Large parts of the observing system are either partly or fully automated. They are therefore expected to continue functioning without a significant degradation for several weeks. But if the pandemic lasts more than a few weeks, WMO said the missing repair, maintenance, and supply work and missing redeployment will also will become of increasing concern. Meanwhile, some parts of the observing system are already being impacted. Most notably, significant decrease in air traffic has had an impact as commercial airliners contribute to the Aircraft Meteorological Data Relay Program, which uses onboard sensors on planes as well as computers and communication system to collect, process, format, and transmit weather observations to ground stations via satellite or radio links. More on the WMO's website. And also today, 4 UN entities, the UN Human Rights Office, the UN Refugee Agency, the UN Migration Agency, and the World Health Organization, issued a joint statement calling on governments around the world to ensure equal access to health services for refugees, migrants, and stateless people, adding that they should be fully included in national response to COVID-19, including prevention and treatment as well as testing. This crisis demands a coherent, effective international approach that leaves no one behind, they said. Migrants and refugees are disproportionately vulnerable to exclusion, stigma, discrimination, particularly when they're undocumented. Protecting the rights and health of all people will be key to help control the spread of the virus, they said in the statement. And also staying on the topic of refugees, UNHCR has laid out a series of measures that are being taken in its field operations to help respond to the virus and prevent further spread. The agency warned that although the number of reported and confirmed cases of infection among refugees remain low, over 80% of the world's refugee population and nearly all of the internally displaced people live in low to middle income countries, many of which have weaker health systems, water, and sanitation systems and need urgent support. The agency has tailored programs in Brazil, Jordan, Mexico, Sudan, DR Congo, Burkina Faso, Bangladesh, and Greece. These programs involve distribution of hygiene hygiene kits and temperature sensors, screening facilities, among other projects. UNHCR is also working with UN partners to find solutions to logistical challenges resulting from disrupted manufacturing capacity as well as border closures. Just taking a look at a few country-specific cases, in Libya, the Office of the Coordination of Humanitarian Affairs said that 8 cases of COVID-19 have been confirmed as of yesterday. The ongoing clashes and restrictive measures in the country due to the pandemic are hampering humanitarian access. Agencies have reported not being able to dispatch trucks to deliver assistance over long distances because of the curfews. Many programs, including those in the 2020 Libya Humanitarian Response Plan, are either being suspended, delayed, or reduced. OCHA has also warned that Libya is at a high risk of virus spreading given its levels of insecurity, weak health systems, and high number of migrants, refugees, as well as internally displaced people. And in Nigeria, the UN team there has mobilized $2 million to procure essential medical supplies. The UN is supporting the economic community of West Africa to procure 1 million test kits. We're also helping to mitigate the social and economic consequences of COVID-19 on Nigeria and are working with the World Bank and key donors to support the government and the people. Turning to the Democratic Republic of the Congo, the mission there said yesterday it helped free 38 civilians who'd been abducted by the ADF rebel group in the vicinity of Mai Moya, just north of Beni. This happened while peacekeepers had deployed reinforcements to support the Congolese armed forces in an area under attack by the ADF. The civilians include women and children that had been abducted by the ADF from different locations in North Kivu and Ituri provinces. They were safely transferred to a Congolese army base. As we've been mentioning in the last few days, the mission takes all necessary measures to contain the spread of COVID-19 in the DRC. It remains fully committed to the core of its mandate, the protection of civilians in support of the Congolese security forces. Turning to Venezuela and Latin America, the joint UNHCR-IOM Special Representative for Refugees and Migrants from Venezuela, Eduardo Stein, today said that while COVID-19 has brought many aspects of life to its standstill, the humanitarian implications for this crisis have not ceased. He urged the international community to boost its support for humanitarian protection and integration programs on which the lives and welfare of millions of people depend, including host communities. Mr. Stein added the current global public health emergency has compounded an already desperate situation for many refugees and migrants. from Venezuela, and their host and funding to support them is urgently needed. The UN continues to work with national and local authorities to address the new challenges brought by the COVID-19 and is delivering basic support to those Venezuelan refugees and migrants. And turning to Yemen, the head of the UN mission in support of the Hudaydah agreements, Lieutenant General Guha, has expressed his grave concern about the increasing tensions in the Hudaydah area. Welcoming the support of both parties that have pledged to the Secretary General's call for an immediate global ceasefire, General Guha urged the parties to, quote, silence the guns, stop the artillery, and end the airstrikes. In light of the pandemic, General Guha said it is ever more important to adhere to the ceasefire in Hudaydah to protect the women, children in the governorate from further hardship and suffering. Meanwhile, the UN Special Envoy for Yemen, Martin Griffiths, met with Yemeni Women's Technical Advisory Group yesterday in a video conference. During the meeting, Mr. Griffiths consulted with the group's member on how to resume the political process as soon as possible to end the war. And turning to Somalia, of 19 countries on the agenda of the UN's Office for the Children in Armed Conflict, boys and girls in Somalia have experienced among the highest level of violence. In a new report by Virginia Gamba, paints a bleak picture with close to 15,000 UN-verified violations committed against children between 2016 and 2019. That includes cases of recruitment and use and abduction of children, sexual violence exceeding those verified in other countries. The full report is online. And from Mali, the UN peacekeeping mission there reports that the tally of results from the first round of legislative elections held Sunday is ongoing. The decision to hold the elections was one of the key outcomes of the national dialogue held in December of last year. The UN peacekeepers and the mission provided logistical and operational support in preparation for the election and secured polling and election sites on polling day. As we mentioned earlier, the opposition leader, Soumaïla Cissé, abducted last week while campaigning in Timbuktu, remains missing. The UN is providing support to the Malian authorities in an effort to locate him. At 1:30 p.m., there will be a virtual press briefing by Ambassador Jose Singer, Special Envoy of the Dominican Republic to the UN, Security Council, and President of the Security Council for the month of April. He will, of course, brief you on the Council's program of work for April. And I'm delighted to welcome not one but two member states who've paid their regular budget dues in full. Our thanks go to Algeria and Kazakhstan, which brings us up to a total of 77. So I will now look to take some of your questions. All right. Bear with me 2 seconds. So from Amanda, the UN is reportedly working on with the company Tencent to provide video conference tools for UN 75. I do not know, and I will check. I will check on that. Did the Secretary General take the decision to extend the work from home expiring April 12th? Yes, it has. The Secretary General has extended that for another few more weeks, and I think others. All right. Any other questions? Hold on. Bear with me 2 seconds. I think I'm getting some other. Pamela asked how the two different funds that the Secretary General has appealed to differentiate. One is an immediate humanitarian fund, and the other one, multi-donor trust fund, is more focused on middle-income countries and economic recovery, and as a ways of cushioning the hit that will come from COVID-19. Philippe, I'm trying to get an exact date. If you bear with me 2 seconds, and I will tell you. The telecommuting arrangements have been extended till April 30th. All right, I understand a number of you are having problems logging in or answering questions. We will work on that with our technical colleagues, and we hope to have that fixed as soon as possible. I'm seeing Florencia type in one more. Okay, Evelyn, you've asked for updates on Africa. I think I've given you some, and we will share whether other country will share others to you. And I really apologize for the technical problems. We will try to sort them out. Thank you all, and see you tomorrow.